that it should actually, does not, like affect the patient digestion or the bala. When patient bala is increased, you can give 15 ml, no problem. That day we have discussed about these things. And here also the first symptom is loss of the weight. When loss of the weight, our treatment should start with the Grutapana.
So the question here is, okay, so we have to come up with the treatment, how we give the treatment. They understood the treatment plan. So now the treatment, so patient in the empty stomach, we are giving Madhukrita, and then it's followed with hot water. Then the second will be Indukadakrita, same kind of dosage followed with hot water. Then in between, we are giving Agastya Rasayana, small dosage every 2 hours. And then the Dhanvantari body is after food, 1 tablet milligrams a day. So they just want to know how you write that prescription in the paper.
See, basically, the line of treatment first start with Agastya Haritki, because patient come with pleural effusion. There is a very severe Amavastha. If I will start with Grutapana and the patient is actually, when there is a pleural effusion and all, and patient is under chemotherapy, the patient is in ICU. So that time there is a Ryle's tube. So I cannot, in Ryle's tube, if we'll give the Gruta, then there are chances, that it will stuck into that tube itself, because Gruta is sticky. It will not go easily into the stomach, and it is very hard for relatives or even nursing staff to practice all these things. So here the line of treatment we should start that when the patient is in ICU during COVID time also, the line of treatment should always start with the very simple medicine, and it should be sublingual only. So we should give the medicine sublingually, just Agastya Haritki every 15 to 20 minutes. You can ask the relatives or the nursing staff, they just give the lehan to the patient, and thereafter there is some improvement in the patient within 3 to 4 days. And they do that, like for the pleural effusion, they do tapping and everything. So when the pleural effusion and everything is okay, when patient get the bala as well, because it is made, Agastya Haritki is made in the Gruta plus sesame oil. So patient definitely, in that also there is a Gruta. So that also started working. I told you the line of treatment should start with the Grutapana. But here there is a Gruta plus sesame oil. There is a Mishrak Sneha. Mishrak Sneha is more, gives, Ojo Vruddhi, plus it is more, gives bala to patient. So the treatment should start with sublingual administration of Agastya Haritki, Muhur. And when the patient is become little bit okay after 7 to 10 days, then we can start with the proper dosage of the either Indukantam Grutam. My first choice is Indukantam Grutam. So Indukantam Grutam we can give like Avapidak Snehapan, that is before food and after food as well, in between, because already because of chemotherapy and radiation the appetite is at very lower level. So we can give in the Avapidak Snehapan, and thereafter like 3 ml before food, 3 ml after food, and in between there should be 1 meal. So that is how we can give in the afternoon. Only 1 meal. In Avapidak Snehapan, there is no need to give, in 3 meals and other stuff. We can give only 1 meal, and thereafter we can, once the patient is, improving and other stuff, thereafter we can start. When there is a, chemotherapy, there are high chances that patient get vomiting, the patient get severe gastritis and other stuff. For that they give, some like Pandy and sort of pantoprazole and everything. So instead of that we can give Yashti Madhu. So it will not cause any sort of gastritis, any sort of vomiting. So you can start Yashti Madhu Grutam to avoid the consequences or the side effect of chemotherapy or the radiation, because Yashti Madhu is very good Vranagna, because that chemotherapy causes Vrana only. gastritis and all other, these symptoms are very common. And thereafter we can use Guduchadi Grutam, we can use other stuff. And when the patient is generally okay, then we can start with Chadanga Paniya, medicated water. We can start with Asa Varishta as well, once the patient gain the weight. So line of treatment should be like that. But for the lung cancer, Agastya Haritki plays very important role. But Agastya Haritki has that one problem, that it has 100 Haritkis. So many a time it causes, the motions and everything, because already the patient is on allopathy medicine and the other stuff. So you just touch the medicine and only sublingual administration. That much dose is enough. Am I clear?
Yeah, so that means it's step by step. We don't write everything in one prescription.
No, not at all. Because these patients are in ICU, they are under Ryle's tube and everything. 73 years female. Already just imagine. You just imagine 73 years female patient. She is already, into the Jara Avastha and everything. So that patient, generally these sort of patient, even COVID time also, the patient were admitted, they are under ventilator and all. I did the mistake that I asked the patient that start with the Grutapana and all, but that is all stuck into the Ryle's tube. And it is very difficult to flush that Ryle's tube afterwards, because in ICU there is lot of AC, air conditioning. So we cannot give Grutapana.
So, main take-home point here, don't confuse with that last slide, all these herbs given at the same time. But given with the step by step. Because since patient was in ICU, first on day Agastya they give, after 3 to 4 days, patient started to get better. Then Induganda Grudam, after a few days, then Eshtimata Grudam, depend on the symptom and Pilvaripadi, but so on it continued. But she just gave a summary of the herbal combinations, what is used for treating the condition, and the result shows before and after 6 months treatment. This got it? Got it.
Even Dhanvantaram Gulika in ICU, we can, just we make Chandan like that. So we just make it like with simple water, 3 to 4 drops, and we can just rub it, and we can make small paste, and we can give it 3 to 4 times in a day. When patient is ICU, these are line of treatment when the patient is in ICU, and we can definitely treat the patient who are under ICU, under, where there is a very bad prognosis, but there our Yuktiva Pashre Chikitsa should be there. We should not be like that, you are giving decoctions and other stuff, because first of all, it is not palatable by the patient, because they are under so many medicines. So always make sure when the patient is in ICU, the patient is on ventilator, or the patient is on other medication, you should give sublingual administration. Just take the medicine, touch it to the patient tongue. That too, keeping the patient, the head on left lateral. So there are very least chances, because already we are giving very little matra, so there is no chances that it will go into the lung and all. But if we'll give the decoction and all, we will make the mistake. So don't do all these things. No one will allow you in ICU otherwise. Okay.
Thank you very much, Dr.
Thank you so much. I just want genuine review of any one of you about this case discussion, whatever it may be, but I want genuine review.
Yeah, you can maybe stop sharing the screen, and they said 110 almost for the. Do you want to say here? How did you learn summary?
These were very hopeful cases.
Yeah,
like it made me learn Ayurveda more. Inspired me to learn Ayurveda.
Yeah, it really is.
Yes, and it's amazing results.
Yes, great result, right? You can see real serious condition with only with Ayurveda, patient with ICU, and they came out, and we have the before and after results. It's very helpful for sure. Yeah, thank you.
Thank you so much. I just want that all of you should be a very good Ayurveda practitioner. I'm ready to take your lectures whole night. I don't mind, but I just want that you should practice Ayurveda. You should have that, mindset, because I cannot, no one can teach you that this disease, this combination. No, it always need Yukti va Pashraya. Once you will understand the basics, you will able to treat the patient. And definitely even world is needed Ayurveda nowadays. We are somewhere lacking, so please learn Ayurveda and practice Ayurveda. That is what I can I can conclude the session with that. And see you soon. Namaste to everyone.
Thank you. Thanks, Dr. Jyoti. We'll talk to you soon.
Thank you so much. Namaste.
Okay, excellent. So you all need the